Comprehensive NCLEX RN Challenge Exam 7. Question 1. The client with varicella will most likely have an order for which category of medication? Antibiotics, antipyretics, antivirals, anticoagulants. Antiviral medications, such as acyclovir, are used to treat varicella, chickenpox, by inhibiting viral replication, especially in high-risk or immunocompromised patients. Question 2. A client is admitted complaining of chest pain. Which of the following drug orders should the nurse question? Nitroglycerin, ampicillin, propranolol, verapamil. Ampicillin is an antibiotic. It is not indicated for the treatment of chest pain or cardiac conditions, making it an inappropriate order in an acute cardiac workup. Question 3. Which of the following instructions should be included in the teaching for the client with rheumatoid arthritis? Avoid exercise because it fatigues the joints. Take prescribed anti-inflammatory medications with meals. Alternate hot and cold packs to affected joints. Avoid weight-bearing activity. NSAIDs and other anti-inflammatory drugs commonly cause gastrointestinal irritation. Taking them with food or milk helps protect the stomach lining. Question 4. A client with acute pancreatitis is experiencing severe abdominal pain. Which of the following orders should be questioned by the nurse? Meperidine 100 mg IM Q4 hours PRN. Mylanta 30 cc Q4 hours Viaducting. Cimetidine 300 mg PQID. Morphine 8 mg IM Q4 hours PRN. Patients with acute pancreatitis are typically kept NPO, nothing by mouth, to rest the pancreas and prevent the release of digestive enzymes. Any oral, PO, medication order should be questioned. Question 5. The nurse is aware that the doctor has ordered continuous observation for a client in the chemical dependence unit because hallucinogens create both stimulant and depressant effects. Hallucinogens induce a state of altered perception. Hallucinogens produce severe respiratory depression. Hallucinogens induce rapid physical dependence. Hallucinogenic drugs, like LSD or PCP, cause distorted perceptions and potential psychosis, necessitating continuous observation for the safety of the patient and others. Question 6. A patient arrives at the emergency department complaining of midsternal chest pain. Which nursing action should take priority? A complete history with emphasis on preceding events, an electrocardiogram, careful assessment of vital signs, chest exam with auscultation. Assessment of vital signs is the priority to determine the patient's immediate hemodynamic stability and provide a baseline for emergency care before moving to diagnostics like an EKG. Question 7. Which misunderstanding by the family regarding pneumonia discharge indicates the need for more detailed information? The patient may resume normal activities as tolerated. The patient should resume a normal diet. The patient may discontinue oral antibiotics once symptoms resolve. The patient should continue use of the incentive spirometer. Patients must complete the entire course of prescribed antibiotics even if they feel better to ensure the infection is fully eradicated and to prevent antibiotic resistance. Question 8. A nurse is caring for an elderly Vietnamese patient in the terminal stages of lung cancer. Which action should the nurse take regarding the family's rituals? Restrict visiting hours to 2 at a time. Notify visitors that only clear fluids are allowed. Keep the other bed in the room unassigned to provide privacy. Contact the physician to report the unusual rituals. Providing the family with privacy allows them to practice cultural rituals and provide support during the end-of-life process, which is a hallmark of culturally competent care. Question 9. The charge nurse is planning assignments. Which is the most appropriate assignment for the float nurse from labor and delivery? A 1-week postoperative coronary bypass patient. A suspected myocardial infarction patient on telemetry. A patient with unstable angina. A postoperative valve replacement patient in a non-surgical bed. A float nurse should be assigned the most stable and predictable patient. A 1-week post-op patient is generally stable, whereas the others require specialized cardiac monitoring. Question 10. An 8-year-old child's physician has prescribed glucagon for emergency use. What is the purpose of this medication? Glucagon enhances the effect of insulin. Glucagon treats hypoglycemia resulting from insulin overdose. Glucagon treats lipoatrophy from insulin injections. Glucagon prolongs the effect of insulin. Glucagon is a hormone that causes the liver to release stored glucose into the bloodstream. It is the standard emergency treatment for severe hypoglycemia. Question 11. An infant with congestive heart failure is receiving diuretic therapy. Which symptom would indicate the dosage may need to be increased? Sudden weight gain, decreased blood pressure, slow, shallow breathing, bradycardia. In CHF, sudden weight gain indicates fluid retention and worsening heart failure, suggesting that the diuretic dose is insufficient to clear excess fluid. Question 12. A patient taking phenytoin, Dilantin, is experiencing breakthrough seizures. Which serum drug level indicates a subtherapeutic level? 15 mcg/ml, 4 mcg/ml, 10 mcg/ml, 25 mcg/ml. The therapeutic range for phenytoin is 10 to 20 mcg/ml. A level of 4 mcg/ml is too low, subtherapeutic, to effectively prevent seizure activity. Question 13. A patient reports taking 3 acetaminophen tablets every 3 hours for a week. Which symptom suggests toxicity? Tinnitus, diarrhea, hypertension, hepatic damage. Acetaminophen is metabolized by the liver. Excessive chronic intake leads to hepatotoxicity, which can result in jaundice, elevated liver enzymes, and liver failure. Question 14. A nurse is caring for a cancer patient receiving subcutaneous morphine sulfate for pain. Which nursing action is most important? Monitor urine output, monitor respiratory rate, monitor heart rate, monitor temperature. Opioids like morphine can cause life-threatening respiratory depression. Monitoring the respiratory rate is the highest priority for patient safety. ABCs. Question 15. A patient has severe lower leg pain after a fall in a football game. Which is the appropriate next step in assessment? Apply heat to the painful area. Apply an elastic bandage to the leg. X-ray the leg. Give pain medication. If a fracture is suspected, an X-ray is required to confirm the diagnosis before applying bandages or heat, which could cause further injury or mask symptoms. Question 16. Which patient is most likely to have an automatic internal cardioverter defibrillator, AICD, implanted? A patient with me without cardiac muscle damage. A postoperative coronary bypass patient. A patient with a history of ventricular tachycardia and syncope. A patient with a history of atrial tachycardia and fatigue. AICDs are indicated for patients at high risk of sudden cardiac death due to lethal ventricular arrhythmias like VTach or VFib. Question 17. A patient is scheduled for an MRI scan for suspected lung cancer. Which of the following is a contraindication? The patient is allergic to shellfish. The patient has a pacemaker. The patient suffers from claustrophobia. The patient takes antipsychotic medication. The strong magnets used in MRI can deactivate or cause a malfunction in a permanent pacemaker, making it a strict contraindication. Question 18. A nurse suspects a patient has developed a pulmonary embolism. Which symptom has the nurse most likely observed? The patient is somnolent. The patient suddenly complains of chest pain and shortness of breath. The patient has developed a wet cough and crackles. The patient has a fever, chills, and loss of appetite. The sudden onset of dyspnea, shortness of breath, and pleuritic chest pain are the hallmark signs of a pulmonary embolism. Question 19. Workup reveals the presence of a rapidly enlarging abdominal aortic aneurysm. Which action should the nurse expect? Admission for observation and medication. Admission for sclerotherapy. Admission to surgery for resection. Discharge home with cardiologist follow-up. A rapidly enlarging aneurysm is at high risk for imminent rupture, which is a surgical emergency requiring immediate repair. Question 20. A leukemia patient has a platelet count of 25,000/microliter. Which action should be included in the care plan? Monitor for fever every 4 hours. Require visitors to wear respiratory masks. Consider transfusion of packed red blood cells. Check for signs of bleeding in urine and stool. A platelet count below 50,000, thrombocytopenia, puts the patient at high risk for spontaneous bleeding. Monitoring urine and stool for blood is essential. Question 21. A nurse teaches family members about infectious precautions for a leukemia patient. Which statement indicates the family needs more education? We will bring in books and magazines for entertainment. We will bring in personal care items for comfort. We will bring in fresh flowers to brighten the room. We will bring in family pictures and get well cards. Fresh flowers and plants are prohibited for neutropenic patients because the soil and water can harbor mold and bacteria, like Pseudomonas, that cause infection. Question 22. A nurse is caring for a patient with acute lymphoblastic leukemia, ALL. Which of the following is the most likely age range of the patient? 3 to 10 years, 25 to 35 years, 45 to 55 years, over 60 years. ALL is the most common childhood cancer, with the peak incidence occurring in children between the ages of 3 and 10 years. Question 23. A patient is admitted for diagnosis of suspected Hodgkin's disease. Which symptom is typical of Hodgkin's disease? Painful cervical lymph nodes, night sweats and fatigue, nausea and vomiting, weight gain. B. Symptoms such as drenching night sweats, persistent fever, and fatigue are common systemic manifestations of Hodgkin's disease. Lymph nodes are typically painless. Question 24. If the diagnosis of Hodgkin's disease were correct, which of the following cells would the pathologist expect to find? Reed-Sternberg cells, lymphoblastic cells, Gaucher's cells, Reeder's cells. The presence of Reed-Sternberg cells, large, multinucleated Owli cells, in a lymph node biopsy is the definitive diagnostic marker for Hodgkin's disease. Question 25. A patient is about to undergo bone marrow aspiration and expresses fear. Which is the most effective nursing response? Warn the patient to stay very still. Encourage the family to stay in the room. Stay with the patient and focus on slow, deep breathing for relaxation. Delay the procedure. Guided relaxation and a calming presence are effective ways to manage procedural anxiety and help the patient remain still during an invasive procedure. Question 26. A mother is concerned her 2.5-year-old son is not yet toilet trained for urine. Which statement by the nurse is correct? The child should have been trained by age 2. Bladder control is usually achieved before bowel control. Bowel control is usually achieved before bladder control. The child should be told no each time he wets. Developmentally, children typically achieve bowel control before bladder control. Physiologic readiness for toilet training usually occurs between 24 and 36 months. Question 27. A 14-month-old child will not fall asleep without a bottle of milk. Which instruction by the nurse is correct? Allow the child to have the bottle at bedtime. Put juice in the bottle instead of milk. Give only a bottle of water at bedtime. Do not allow bottles in the crib. Bottles in the crib at night are the primary cause of early childhood caries, bottle rot, and increase the risk of choking and ear infections. Question 28. Which of the following actions is not appropriate in the care of a 2-month-old infant? Place the infant on her back for naps. Allow the infant to cry for 5 minutes before responding. Talk to the infant frequently and make eye contact. Wait until at least 4 months to add cereals to the diet. At 2 months, infants are in the trust versus mistrust stage and lack the ability to self-soothe. They require prompt responsiveness to build security. Question 29. Which of the following suggestions would be helpful to prevent constipation in an older patient? Moderate exercise for 30 minutes each day. Drink 6 to 8 glasses of water each day. Eat a diet high in fiber. All of the above. The combination of physical activity, adequate hydration, and high dietary fiber is the gold standard for preventing and treating constipation non-pharmacologically. Question 30. A child has suspected rheumatic fever. Which of the following observations is not confirming the diagnosis? A reddened rash over the trunk, a history of sore throat in the past month, a negative anti-streptolysin O, also, titer, an unexplained fever. A positive OSO titer is required to confirm a recent streptococcal infection, which is the necessary precursor for a diagnosis of rheumatic fever.